Welcome to this video tutorial on Portacath Access. The Central Venous Access Device Kit found in the Special Procedures bag contains all the items you see here except for the bag of saline and the maxi drip. The saline flushes contain sterile saline and have a sterile fluid path, but unfortunately the syringe itself is not sterile and therefore it cannot be placed on the sterile field. In order to complete the procedure, you may also need a couple of alcohol preps. Tunneled established vascular access devices, or EVADs, has some distinct advantages over non-tunnel catheters. There's less chance of them becoming dislodged. Also, the tunnel and the cuff on the inside decrease the rate of infection. Tunneled catheters can stay in for a longer period of time compared to their non-tunnel counterparts, in some cases for several years. Subcutaneous access ports are considered tunneled catheters. They may be referred to as a port or a portacath, and they must be accessed utilizing strict sterile procedure. Before cannulating an established vascular access device, determine if the device is viable. Then, get the patient's permission, and finally, contact medical command providing any pertinent findings and also any of the pertinent negative findings. Any patient equipped with an established vascular access device may have their device cannulated under standing orders, provided that they are in cardiac arrest or in shock, and peripheral IV access has been attempted at least twice. The first step in the procedure is to prepare our sterile field, which contains our sterile fenestrated drape. Once you remove the field from the packaging, always remember to handle the posterior side of the field so as not to contaminate the anterior portion of the field. Next, we'll open up our CVC kit, the contents of which are sterile. It's helpful to know that the CVC kit is always packaged the same way. The mask is on top, which you'll take off carefully and put on yourself, and underneath that are your sterile gloves. Since you've contaminated the outer packaging of the gloves, place them on any nearby non-sterile surface to avoid polluting your sterile field. Get started by getting your fingers started inside the glove. Only touch the outer cuff. Notice with the first glove how I avoid touching the inner cuff with my left hand. That would contaminate the glove. With the second glove, get your fingers started inside the glove just as you did with the first one, and then grab the inside of the cuff and pull it over your wrist. Just remember not to touch the clean glove to your dirty hand or wrist. I'm having a little difficulty because my hands are moist. If you have clean gloves on, leave them on and put the sterile gloves over top of them. In our CVC kit, the alcohol is supplied in a foil pack. Squeeze the wings together firmly to allow the solution to be released and flood the applicator sponge. ChlorPrep is applied in a crosshatch pattern for about 2 minutes. Once the ChlorPrep is dry, position the drape with the sticky side down so that the opening is directly over the port. Then, carefully open the drape and follow the printed arrows that indicate the direction it is to be pulled. Because the saline flushes can't be placed on a sterile field, you'll need an assistant to help you with this part. So ask your assistant to unpackage the saline flush while you remove the sterile blind cap. Your assistant must eliminate any air from the syringe and then carefully attach to the Huber needle set without contaminating it. Once this is accomplished, unclamp the set and prime the Huber needle. Then reclamp, remove the syringe, and replace the sterile blind cap. Now you're ready to cannulate the subcutaneous access port. Never cannulate a subcutaneous port without first stabilizing the port with your index finger and thumb. Insert the Huber needle directly in the center of the stabilized port until you meet resistance. Once you meet resistance, stop inserting, leave it in place, remove the blind cap, attach a brand new saline flush, and confirm patency by establishing that you have a brisk blood return and good flow when flushing.